I was alone with my thoughts, with my grief. And that was when, I caught myself thinking, somebody needs to fix this. There has to be a way for us to be able to diagnose diseases early, for things to be treated before it becomes a problem. So during that period was when I started to work on Healthtracka. One of the proudest moments would be just the sheer amount of people who reach out to us every day, thanking us for catching their abnormal lab tests early, and now they're getting treatment, and for some of these things, it gets treated completely. That makes me fulfilled, knowing that we are solving the problem we set out to. The idea for Healthtracka was I wanted people, a way to decentralize diagnostics. I realized that a lot of people were waiting until they could feel a symptom before going in to see a doctor or before going in to take medications. How can we make it easier for people to access basic lab testing that gives an indication of what the problems might be in their body? And that was the story of how Healthtracka started.
Hi, Ifeoluwa, how are you doing today?
I'm well, thank you. Thank you, Paul.
Yeah, it's nice having you today again. I think in the health tech space, a lot of people are aware of what Health Tracker is all about, but I would like you to start the journey, the story of the journey. When did you start thinking of Health Tracker and how did it all come together?
Yes, thank you for having me on. So I always say that the story of Healthtracka was that of a tragedy that happened, and I knew that I had to be part of solving the problem for a larger population, right? So before now, I was a regular 9 to 5er, but then my background has always been in medical science and then digital technology. Right. So it started when, I got the call that my dad had passed. And again, that was strange because it basically just slumped one of the days. And it was surprising because his doctor just told us that he's had hypertension and diabetes untreated for so long, and that degenerated into a stroke. This was very strange considering that I could not even remember seeing my dad heal. But then he had never gone to the hospital, right? So we had no idea. Nobody was tracking anything. And his case was not unique. So during my grief was when I realized that millions of Africans actually lose their lives for diseases that could easily have been treated if caught early. And there is that problem of rise in non-communicable diseases in Africa. I remember the year was 2019. In fact, a few days was this remembrance, right? 5 years remembrance. 2019, I was grieving through November, December, and I think it was February 2020, the world went into COVID, right? And the world shut down. I always say that it was during that time because everybody had no choice. We had to be at home. I was alone with my thoughts, with my grief. And that was when, I caught myself thinking, somebody needs to fix this. There has to be a way for us to be able to diagnose diseases early, for things to be, treated before it becomes a problem. So during that period was when I started to work on Healthtracka. So my background, for my background, I studied biochemistry, and then I've always been in the digital technology space, leading products and building software products as well, both in tech companies and even in medical industry as well. And the idea for Healthtracka was I wanted people, a way to decentralize diagnostics. I realized that a lot of people were waiting until they could feel a symptom before going in to see a doctor or before going in to take medications. How can we make it easier for people to access basic lab testing that gives an indication of what the problems might be in their body? And that was the story of how Healthtracka started.
Thank you very much for that explanation. So let's talk about the journey so far. How has the experience been? What are you proud of the most with Health Tracker? And which space are you really, really proud that this is the reason why we are doing it, that we've been able to achieve this? What can you share about that?
Well, absolutely. I mean, one of the proudest moments, if I will start from there, would be just the sheer amount of people who reach out to us every day, thanking us for catching their abnormal lab tests early, and now they're getting treatment, and for some of these things, it gets treated completely. That makes me fulfilled, knowing that we are solving the problem we set out to. It's been 3 years now of running Healthtracka as a business. And it has been a roller coaster. It has not been really its challenges. But then one of the things I've learned is that you can never fully see the end from the beginning, no matter how fantastic your business plans are. But it is the walking that creates the road, right? Because the more we walk down this road, the clearer it becomes, right? So from year 1 to year 2 to year 3, and a good example of that was last year we began to look closely into women's health. And that was because we saw that women were getting diagnosed later than men, and women were spending more time in poor health than men. We probably wouldn't have come into that conclusion or seen that data if we're not doing what we were doing before. And now we're beginning to innovate around women's health. And in summary, what makes us really proud, of course, the feedback from our users, from people, and just that sheer amount of people, hundreds, thousands that were able to get diagnosis for early before it becomes a problem makes us really excited. But more importantly, we're also creating new product innovation, new mission, and we're identifying new problems that we want to solve in the sector. Yeah.
Yes, thank you. You mentioned something that I'm curious to push a little bit back on, that men get diagnosed earlier than women. But the conventional perspective is that men are always probably busy, they don't bother about their healthcare, and they don't really, until they are really sick, that is when they go to the hospital. And I think some people will argue that that is why a lot of men that have prostate cancer don't detect it on time, because they are busy chasing money and not taking their health as serious, compared to women that once in a while could have reasons to have something to do with the health facilities.
Yeah, I mean, two things can be true at the same time. Men also get diagnosed late, but in comparison, because women actually have more health concerns than men, so the diagnosis for the different diseases actually is the one that I'm talking about. So, for example, things around endometriosis, things around fibroids, things around hormonal health issues get really diagnosed late for women, because we just not have enough research around that. And most of, from just like an healthcare sector point of view, these are things that are deprioritized, right? Especially also in an area like Africa, where, when it comes to gynecology, reproductive health and maternal health is bigger on the priority list. So I do agree that men need to do. We need to get more men as well to diagnose men faster as well. But because women spend more time in poor health than men, it means that women actually have a lot more health issues to deal with, and we don't diagnose them early. Right? For men, it's sometimes it's usually, again, statistically, a lot more straightforward to diagnose men.
Okay, yeah, I think that's the fair point and quite balanced. Everybody needs to seek health care. So now let's talk about the product that you currently have, the current branching. I know you say you have different products, so let's talk about what is currently available through your tracker.
Yeah, absolutely. I remember, our first product when we launched Healthtracka was a digital platform where, users and people could order for lab tests from home, and they would get the test done at home, right? And a dashboard where you can have your results, and from there access a doctor, get medications at home if needed, or even vaccination. Right, so we have that product that serves as a channel for people to get testing done remotely. But beyond that, we've also added, real product as well to it. So we launched the first HPV self-sampling kit in the country, allowing women to screen for cervical cancer from home. Right, with the kit, women can take their own samples. We send that samples to the lab to ensure that the results are lab grade, and they also get their results on their dashboard, and can keep and send to their doctor, or speak to our own doctors internally as well. Beyond that as well, we've launched a product around STIs, right? Again, self-sampling kits, because we realized that there is a stigma around sexual health testing, and it's one of the It's one of the leading causes of HIV. In fact, 60%, if I'm not mistaken, 65% actually of new HIV cases are found in young women in sub-Saharan Africa. And one of the biggest challenges is, one of the biggest challenges is just the stigma around women testing for, and just going to their pharmacy or doctor to acknowledge and admit that they've been having sex. So we created a product called Lemon, which is a kit, and partnered with pharmacies across the country. So all you need to do is just go to your pharmacy and ask for a lemon, and then they know exactly what to give you. Right. We have like range of products around self-sampling kits to ensure that we are decentralizing access to healthcare and ensuring that diagnosis starts before treatment and care. So we partner with pharmacies as well, because we also realize that in Nigeria and in most parts of Africa, actually, community pharmacies are the first point of call for most people. So they are the primary healthcare centers. But most of the time, they go straight into treatment. So we're working with pharmacies now to introduce diagnosis before treatment. Therefore improving the standard of care in the country. So yeah, those are some of the products that we have. We have AI products as well for menstrual health, and we've launched quite, a couple of digital products as well.
Okay, thank you. So let's talk about Healthtracka as a business.
Mm-hmm.
So you talked about this personal drive that was the story behind the company, the organization. Now, let's talk about how you started seeing it beyond just something to help others, but actually setting it up as a business properly. And so let's start from that before we start talking about the current market dynamics.
Yeah, it's interesting that from day one, I treated Healthtracka as a business, right? Of course, it comes from a position of seeing a gap and the problem that is social impact, but I still saw it clearly as a business from day one. And I think, that shaped the way I approached setting up the company, right? So from day one, it was a for-profit company. From day one, we had paying customers. From day one, I was thinking about how could, getting investors to increase our chances of success and also innovate faster. So, I feel like it's even now that I'm beginning to now, think about making it a lot more social impact, but making it, or creating a more non-profit side of things, right? Because it's healthcare, because, what we do is literally saving lives and helping people. There is a huge social impact side of what we do, right? But from day one, structurally, legally, we've thought about it from how do we ensure that this is sustainable and this can be affordable for people to pay for, and we can also afford to keep everybody working on it, right? And pay salaries and all of that. So yeah, we've always treated it as a business.
Okay, now I think a major problem that people in this space, often innovators, startup founders like you, probably often have to encounter, and compared to the players in sectors like, let's say, for instance, fintech or agri, where everything is just about, yes, we have to make profit. People know that this is a business venture, compared to health sector, where the fulcrum is all around making sure that people don't die. How do you think the nature of this sector and its social leaning, peculiarity, affects it or limits the growth of that sector?
Yeah, it's such an interesting conversation, and we have it in the sector a number of times that the Africa healthcare sector has always been subsidized, right? So the sector has never really been tested fully in terms of what people can afford in that sense. And because healthcare costs money, right? So, and then, we also know that in Nigeria, for example, the poverty ratio is just incredibly high. Right, so there is that part, and then obviously insurance is less than 3%. So people are not insured. People are making less than $1 a day, and they have to pay out of pocket for healthcare. So those are some of the nuances and challenges of that sector. So it becomes very difficult for growth to happen in the way it would happen for financial services. Again, and it's just based on Maslow's hierarchy of needs. In Africa, we're still dealing with the lowest range of Maslow hierarchy of needs, right? It's food, it's transportation, it's shelter, and of course financial services fall into that, because you need to pay for food, you need to pay, you need to transact daily, and most people still, earn less than $1 a day. Layer on top of it that less than 3% of the people have any sort of health insurance. Another layer is that, most people just simply can't afford it, right? Because you have to pay out of pockets, right? Which is why the default is for people to go to the nearest community pharmacy to get a drug or anything if they feel like they're sick. And it's just not priority, right? So there is an argument for the fact that healthcare as a business, from a purely for profit point of view, may struggle in places like Africa because of just that ability for people to pay, right? So I do get where that comes from. And there is also the other part where, healthcare in Africa has largely been subsidized by, international donors, and just a lot of support from other parts of the world to ensure that people are not totally at the mercy of only what they can afford, right? So the growth in health, in the healthcare sector, definitely has not historically been as fast as the other sector. Again, it's pure logic. It's just the hierarchy of needs, and people need to prioritize based off of the resources that they have. So I do agree, actually.
Do you think we are missing out because we are not extensively monetizing our health tech space?
So, I mean, and I think that, we don't have a choice. We need to solve our fundamental problems first before we go into core technology, right? And I think I'll still, reading that somewhere, that right now, our biggest worry is still around service delivery, the infrastructure to do that before we now begin to layer, core tech on it, or deep tech on it, on it, right? I remember when we launched, when I was launching Healthtracka, my dream, or rather my vision at that time, was for us to be able to have phlebotomists on bikes, so that, anyone who is booking a test can get a phlebotomist so fast that it's almost like when you order things from, I don't know, Jumia or any of the leading e-commerce companies, right? But just the infrastructure that meant, it would mean to literally start a new logistic company, train phlebotomists, get them on the bikes, do a whole, the infrastructure. We had to build like a parallel, industry in that sense, or go into another sector, another vertical. And that's what happens with this, right? Because innovation cannot exist outside of the markets that you operate in, right? So for us, we had to do a bit of that. We had to become a logistics company. We had to train people. We had to put them on bikes. And that required just a lot more resources that if we were in a different part of the world, we wouldn't have to just lay on what already exists. So I would say that that's fundamentally what we need to be doing right now, to be solving for the fundamentals that we can build on to enable more innovation, to enable more health tech solutions. So for example, I remember speaking to even government, right? They love all the health tech solutions that innovators are coming up with. The problem is the fundamental solutions that those health technology solutions will integrate with does not exist today. So now we have very ambitious people in government who wants to do that. So I would say that, yeah, we're missing out, but it just takes a bit of, prioritizing and realizing what it doesn't take so much to build the infrastructure that we need, actually. We just need to be a little bit more creative with it. Of course, and that's why, to your point, it slows down the rate of growth from a business growth point of view, right? That, a startup is meant to have, right? In an health tech sector. For people in financial service, for fintechs are doing so well. Obviously, why? Because we already have the banks who have built a lot of the infrastructure. You already have the regulatory frameworks, you have CBN, there's a whole lot in that sector that has been figured out, that anyone coming into that sector does not have to start from the scratch, right? You literally can, build on top of all these things. The problem is for the healthcare space, we just don't have that infrastructure. So we can't say we're missing out on something that we haven't invested in.
What about the direct to user verticals for health tech innovation? If we are talking about that the government is not providing this, we are not giving this, what about the individual potential consumers of health tech solutions? How does that market look like at the moment?
Yeah, I mean, that market is what everybody is feeding off right now, right? So, and it's the reality of what exists, right? So we, for the past many years now, more than 3 years, we have been serving customers who are able to pay out of pocket for our services, right? And yeah, I mean, we're growing. It can be better, it can be faster, right? But the point is, it makes the competitive landscape also just more messy in that sense, right? Because everybody in the sector is looking at this, small sector or a small sector of people who can afford to pay out of pocket. While that is great, the path for scale that we think about is how about we open this up? How about we create more of that market? How about we insure more people? How about, we have some of the infrastructure that makes us begin to think more mass markets when we come to talk about healthcare as opposed to niche. So I would say that yeah, you have to. I think almost everyone in the healthcare sector does that. We work with insurance companies. We work with who are insuring just 3% of the population. We work with corporate organizations who can afford to pay at least subsidized healthcare for their employees. You work with B2C customers who can pay for their own healthcare out of pocket, right? So we all are competing for that space. The clamor now, the drive now is how can we open up that market to be bigger?
Yes, I think you are really really taking the conversation to what I also want to talk next to. What really really needs to happen for these bigger markets to actually open up, and we can now see the health tech spaces, health tech players like you actively maximizing the potentials of the market and being able to expand the addressable clients that you are not able to currently address because of these very problems that we've talked about. So what needs to happen for you to be fully and satisfactorily profitable in the Nigerian and African market?
Yeah, I mean, that's a good question. I think a good start will be a lot of collaboration with government, with regulators, with healthcare providers as well, right? So, I mean, I'm in the diagnostic space largely, and I always say that despite how tempting the B2C market is in diagnostics, almost 90% of all the referrals that happen when it comes to medical diagnosis comes from doctors, right? So we need to be speaking to doctors because doctors are the ones who see multiple patients every day. So when we're thinking about scale and growth, we need to be thinking where are the numbers, right? And then when you think about government, right, because you're thinking about the teaching hospital, you're thinking about primary healthcare centers. There are a lot of problems there that healthcare innovators can solve for, right? And it's simple solutions, but it just requires a little bit more of collaborations that actually helps that sector opens up, right? And it becomes a win-win for everybody involved. I think right now the Ministry of Health, for example, has a huge agenda around digital health. There was a program that they had recently, and I know that there's a lot of work going on there to say, okay, yeah, now we need to be able to digitize. Because the problem before was we don't have a lot of that interoperable systems that health tech companies can actually plug into and solve the problems once and for all for the entire nation. So there's a whole lot of conversations going on right now that I think would help, but it is, as business people, we always need to keep our eyes on the numbers. Where the critical mass going to come from? If the critical mass are coming from people who are not insured or people who are under government insurance, how do we serve those customers in a way that is profitable? And it's a game of numbers. We can't serve them because it's a game of numbers, but now we need to collaborate, we need to and work with each other maybe, but more importantly work with government. Healthcare I mean, as you know, that in most places that has worked well, maybe not the US, has always been from a centralized system. Yeah, where the government has taken a lead, if you get what I mean.
Absolutely. Okay, okay. I think I'll give you that. Still looking at what we currently have on the continent, do you think it's possible for health tech startups like yours to actively disrupt without having to do with partnering or leveraging social sectors, for instance, donor funding organizations, NGOs, and other active players in these various sectors? Do you think it's remotely possible to be able to say that we can grow this sector without relying or hoping to get donor funding to back the drive?
Absolutely. I think there are sectors, I mean, there are subsectors within the healthcare space that just make sense, right? So if you're in the pharma industry, if you're manufacturing or you are retailing, I mean, again, pharmacies are the primary healthcare centers, whether we like it or not. So people are always going to need drugs. They're going to need anti-malaria drugs. And you're gonna be okay without enough funding, obviously. Same thing with even some insurance companies, right? Again, if you're able to convince and take top three of the insured, the 3% of the insured patients on the continent in Nigeria, you probably can have an healthy business. I think where it begins to get a little bit complicated is if you're serving the people down uninsured and don't have as much to pay. And especially because innovations also cost a bit of money. So then something we need to fund that innovation before it happens. So, and which is why you probably we don't see as many innovation in the healthcare space because we're still dealing with the fundamentals. But I think that is possible for some of the subsector. In diagnostics, maybe a little bit, but of course the challenge there is then, especially with inflation that is happening, machines cost a lot of money, reagents, everything is imported, right? So the more inflation happens, there's just a huge cost, a huge increase in the cost, and which means people are not able to afford to do tests before they go in for treatment or just take guesswork when it comes to treatment. So it is possible, but it would depend on the sector. So, which is why a lot of the social interventions are still needed at this point. So, the other part of it, I think, has benefited from social intervention is even the awareness, right? For most health tech companies, you literally do not have the free money to educate people, right, before you offer the solution, because you're thinking customer lifetime value and all of the business terms, in the way you think about your cost of marketing and all of that. With healthcare, it's a little bit tricky because, so for us in diagnosis, for example, if you have your full body checkup test done, maybe maximum 2 times a year, if there's really nothing wrong with you, how do we convince you to keep coming back? Is it even ethical to keep to telling you to come test, right? So, or do we then focus on sick people? But then there is the cost of educating people so that when are you expected to come in for your checkup? What do you even know about HbA1c? How do you know that you have high cholesterol? And all of that. And I think that's where it becomes tricky in terms of who pays for the cost of that, who bears the cost of that. Can healthcare businesses actually incur a lot of the cost when it comes to educating the public about this before then selling the solution? So, I mean, back to your question, I think it's possible. It would depend on the subsector where in healthcare where that is possible.
Okay, I think there's a sector I want us to quickly talk about now, which is cancer. I know
Yeah,
you have
oncology.
a product in that line. So
Yes.
what are you hoping to achieve with your cancer offering? Before I start talking about the dynamics in the sector.
I think, I mean, my mantra when it comes to healthcare is that prevention is better than cure, right? So, I mean, we think about healthcare, or the way I think about healthcare is obviously awareness detection, and then treatment. So for us, when we're thinking about it, when we're thinking about our solution is how do we get people diagnosed early enough when they still have a chance of surviving, right? And living a quality life, right? Because it's one thing to survive, it's another thing for you to still live, have that sense of a quality life, right? So almost all our products is geared towards early detection. So for the HPV self-sampling kit is how do we get more people screening? Less than 8% of Nigerian women have been screened ever for cervical cancer. It's too much of a preventable disease, so much of an aggressive type of cancer for us to treat it with levity, right? So we need all the innovation and all the products and all the solutions to get more people testing, because we know that that quickly improves health outcomes, right? The statistics right now, I think, is that 85% of people who are diagnosed with cervical cancer do not make it. But if you're diagnosed before the symptom comes up, you know your chances of survival are really, really high. So that's the way we think about oncology on the continent, is how do we get more people diagnosed early, right? And then funneling people who at the later stage to the right pathway when it comes to treatment, because most people also, we have users who, of course, they are presenting very late. By the time we're catching it, they need treatment immediately. Some of them are in stages that require a lot more, it's just a lot more care. It's for some of them, it's not even just treatment, it's now care in that sense. So we think about it. I think a lot of efforts and innovations and product goes into the diagnosis part of it, because we want early detection and early diagnosis, and then a pathway to guiding to treatment.
Hmm. That seems quite ambitious. And are you going to just focus on cervical cancer like you do?
So when we start, before we even created a product for cervical cancer, we offer prostate cancer screening, we offer breast cancer screening, even colon cancer, as much as possible. We do tests like CA-124/5 that you can even do at home as well. So all these tests are available on our platform, and you can basically order them. So I mean, just to set that baseline in terms of, we look at, or as much screenings as you can possibly do. In fact, there's a partnership that we're looking into for next year. The SLAs right now to be able to offer predictive cancer screening.
How is that uptake? How are you driving it? And what is the insight so far? No matter how little the data you have on that could be compared to cervical cancer, the health seeking culture of men. So how are you driving that? What insight can you give us from that experience?
So it's interesting that, I think that men, I mean, I don't know how I feel about saying this, right? I feel like men respond better with logic, right? So almost straightforward, right? If prostate cancer is the leading cause of cancer related death for men, so you need to screen at least once in a year, right? Especially once you're closer to 40 and above. I think that some men are afraid, obviously, but the data we see is when the logic is presented, the uptake is great for men. There's less fear when it comes to testing for that. One of the, and when I mean logic, is the misconception is men typically think prostate screening and think that, oh, somebody's going to have to touch balls to pick something or to draw something, right? I'm telling you, oh no, it's just a simple blood test. And that changes the game. I'm like, oh, really? Well, that's not too bad. And that's it. For women, it's a little bit more emotional selling that we have to do.
Mm-hmm.
That it's almost like you're talking more about family and why it's important for them to take care of themselves. No. Of course, these are not absolute statements. This is just
Mm-hmm.
general, right? If I guess it's interesting in the way we do our communication and marketing when we talk about this. So we try to tailor as much as possible to the different segments, the way they think.
Okay. So what's next in how do you see Healthtracka growing as a business, despite the fact that you work in an emotionally laden and charged sector that sometimes we just feel like we really need to help this person. Let's give these things out for free. Or let me see, how many tests have you given out for free out of passion for the person affected? And so what is your vision for growing this as a business?
Yeah, so I mean, I always say that every revenue is revenue, right? So when we think about this, we think about, and that's the way we think about it even for the future, is we just need partnerships to reach more people. At the end of the day, our goal is obviously to ensure that our shareholders and investors, have a return on their investment. But more importantly, is ensuring that our mission gets fulfilled, where we are bringing diagnosis early to the people. So it is that fine balancing between ensuring that the business is sustainable and then ensuring that the mission is also achieved and actualized, right? So our goal is always to think about what is the best way to do that. A good example, as I mentioned, is we partner even with with an organization who then fund some of the activities that we do. They pay us for it, right? And then we still achieve both ends. That way, we're still able to keep people's salaries and keep ensure that the business runs, achieve that, and then we have a segment of our customer base who pay for themselves. We have a segment of our customers who are businesses, right? Who just they need pre-employment tests for their employees, or they need to do annual screenings for their employees. So it's diversifying our customer base in a way that ensures that we stay in business.
Okay. So if we have an entrepreneur that is working or struggling in the health tech sector in balancing, structuring as a business and satisfying the social enterprise tag that comes with health innovation or health sector in many African countries. So what will you say to that person?
I mean, no, number one, I would say that they most likely never have to worry if their social impact enough, because healthcare in Africa is social impact, whichever way you want to do it. The mere fact that the work that you're doing is helping people get better is social impact. So my advice is to focus on how to ensure that their venture is sustainable. Right. On one hand, if you have partners who are willing to fund your activities, absolutely take them on and work with them. If you have customers, or if you see and is identifying the sector, or sorry, the customer segment who needs your services and will pay for it, find them and serve them. If you find businesses who are willing to pay for what you're offering and is for healthcare services, please find them. But at the end of the day, the goal of every business is to make money, right? So you want to ensure that you're keeping your eyes on that as much as possible. Because at the end of the day, you will not be able to help the people if you are not alive as a company. But my advice is ensure that you stay alive. Find the revenue that helps you stay alive. If it is with donor organizations, fine, okay, right? Because it keeps your mission alive. It is with people who are able to pay out of pocket, do that. But just find people who can pay you.
Okay, thanks so much, Ifeoluwa. So any last remarks from me?
I think that the healthcare sector is very new in a lot of ways. We're still figuring out a lot of things, but I think that we also have made so much progress the last 10 years, if I'm right. I remember that when I was launching Healthtracka, one of my biggest worry, because nobody had done what we had done before, was would anybody open their homes for strangers to come in saying they want to take blood samples? And I was on the phone taking those calls and hoping that my voice inspires a lot of trust. Because I remember for the first 100 customers or users that we had, right? So I think that we have made so much progress, and now just need to set the tone for the next 10, 15 years. I would say that we need, the only path through this is forward. In another 10 years, I can imagine that we probably will be celebrating our first unicorn in the healthcare sector. So my fingers are crossed for that. Hopefully it will be us.
I think that was one thing I wanted to chip in. Do you think that health unicorn would be Healthtracka?
I really hope so.